Manus. I'm a senior associate for learning and dissemination here with the National Community Action Partnership, and I'll be working behind the scenes today along with my colleague Denise Waits and Katie Smith to help the webinar go smoothly. A few technical notes before we get started. We will be recording the webinar, and we will share both the recording and the slides with you within 1 to 2 days following the presentation. If you have any questions or comments during the presentation, please submit those through the chat function. Again, welcome and thank you for joining us today. Today's webinar is on the topic of deepening community action engagement in homeless service delivery and why it matters. Today's webinar is brought to you as part of the Learning Communities Resource Center, the LCRC. The Learning Communities Resource Center is the learning hub within the CSBG network that supports the identification, adaptation, and implementation of innovative, evidence-informed services and strategies to improve results based on individual, family, and community-level outcomes for the CSBG network. This webinar is being offered as part of the LCRC's Housing Opportunities Expansion and Homelessness Prevention Learning Community Group, which focuses on a spectrum of housing challenges and opportunities, including homelessness prevention and rehousing. We want to begin by acknowledging that every community owes its existence and vitality to generations from around the world who contributed their hopes, dreams, and energy to making the history that led to this moment. Some were brought here against their will, some were drawn to leave their homes in hope of a better life, and some have lived on this land for more generations than can be counted. Today, I'm joining you all from North Carolina, and for me, this meeting is being held on the traditional lands of the Lumbee people. I pay my respect to elders, both past and present, who have stewarded this land throughout the generations. We invite you to use the chat to acknowledge the lands where you're joining us from today, and we'll share a link in the chat for you to learn more. We also want to begin by grounding ourselves in the promise of community action and reminding ourselves what brings us all together here today. Community action changes people's lives, embodies the spirit of hope, improves communities, and makes America a better place to live. We care about the entire community, and we are dedicated to helping people help themselves and each other. A quick review of our agenda for today. We'll have our welcome and introductions, followed by a presentation from our speakers on deepening community action engagement and homeless service delivery. We'll also address any questions as time allows, and then we'll close with resources and upcoming events. As I mentioned earlier, my name is Karis Manus. I'm a senior associate for learning and dissemination here with the Community Action Partnership. I also wanted to introduce you to the rest of our practice transformation team. We have Tiffany Marley, Senior Vice President of Practice Transformation, Lily Seals, Director of Practice Transformation, Jennifer Gregory, Director of Mobility, Learning, Design, and Practice, Taylor Daniel and Tamaritis Hollywood, who are Senior Associates of Learning and Dissemination, and Katie Smith, the newest member of our team as a Program Associate for Communication and Dissemination. And without further ado, I want to introduce you all to our speakers for today's webinar. So joining us today, we have Mary Frances Kenyon and Sharon McDonald with the National Alliance to End Homelessness. They are also joined by Jimmy Jones with the Mid-Willamette Valley Community Action Agency. Mary Frances is the Vice President of Training and Technical Assistance with the National Alliance to End Homelessness. She has over 15 years of experience helping nonprofits and local governments reimagine their homelessness response systems. Sharon McDonald is a Senior Fellow for Families and Children with a focus on policy and program strategies to address family homelessness. And Jimmy Jones is the Executive Director of the Mid-Willamette Valley Community Action Agency in Salem, Oregon, where he oversees more than 200 grants and a staff of 509 programs, including weatherization, energy, home, youth, and resource center, nutrition first, weatherization, reentry services, childcare resources and referral, Head Start, and the Arches Project. Over the last 5 years, he has supervised the expansion of the agency's housing and sheltering work to include a navigation center, Arches Inn, Arches Lodge, Tanner's Project, and Taylor's House. He is an advocate for homelessness and anti-poverty work across the state of Oregon, and also serves as the Vice President of the Community Action Partnership of Oregon. And with that, I'm going to turn it over to Mary to get us started today. Thank you all again for joining us.
Thank you so much, Karis, and thank you to each of you who have joined us today. I'm super excited to be here, relatively new to my role, but I know that each of you has joined us today to understand the ways that community action agencies have expanded their work on solving homelessness while really balancing your primary mission to end poverty in alignment with sort of the goals of homeless services system. So I have spent roughly the last 1.5 to 2.5 years in the state of Oregon. And I know from my work there that there's a strong community action network of over 17 community action agencies and including the Oregon Human Development Corporation, which is like a statewide agency to serve farm workers. But I'm a little bit of a storyteller. So before I introduce or turn it over to Jimmy Jones, who will be our speaker today, I just want to kind of give some background context. So if you've never been to Oregon before, it's such a beautiful part of the Pacific Northwest. It's rich in state and local parks. There's an abundance of outdoor activities, beautiful rivers, scenic byways. My personal favorites, home to Tillamook cheese and ice cream. Sorry if you're a Ben and Jerry's fan or fanatic, but they've got excellent food. And when I've visited, I've been met with such friendliness and warmth from Oregonians. But Oregon is also like other areas in the country where homelessness is very prevalent and very visible. Oregon has one of the highest rates of homelessness in the country, along with California, Vermont, and Hawaii. And between 2020 and 2022, so those kind of core COVID years, they had a 22.5% increase in homelessness. And of the nearly 18,000 people experiencing homelessness on any given night, certainly an imperfect measure, but more than half of those 18,000 experienced homelessness outdoors. Now, when people think homelessness in Oregon, they tend to think of Portland. But what I learned, and as I made my way down I-5, which is the local interstate on the west coast there, into the state's capital of Salem, homelessness is both prevalent and very visible. Salem, of course, is home to the sort of headquarters of Mid-Willamette Valley Community Action Agency. I believe it's the largest CAA in the state, and it primarily leads programs throughout Marion and Polk counties, which is inclusive of rural communities. I think a unique feature that I want to share, and Jimmy will have an opportunity to touch on this as he shares about how they lead in the homelessness response there. It's also home to the State Correctional Institute, State Penitentiary, and State Mental Health Hospital. And that's very noticeable when you drive into Salem. Specific to this community on any given night, there are roughly 1,800 people experiencing homelessness, quick point in time count. And almost, but not quite, half of them do so outdoors. So it is my really my honor and privilege to be able to turn it over to Jimmy Jones, who I've had an opportunity to work with over the last couple of years, doing some great work in Oregon. And Jimmy, I'm going to kick it over to you.
Thank you, Mary Frances, and good afternoon, everyone. It's still morning if you're on the west coast of the United States, but it won't be for much longer. I'm really delighted to have the opportunity to be here today and speak to all of my friends and colleagues in the Community Action Network and other folks across the country. It's a really unique opportunity that we have every once in a while, and I really love the work that we're doing here locally, and delighted to have the chance to talk about it in a national context, and especially, I think, in some ways, we're at, in a lot of ways, a crossroads for community action in the country, especially as the face of poverty continues to change in the 21st century, and the depth of poverty issues surrounding the homeless issue on the West Coast have become so prevalent. Just a little bit of background on me. I never intended to have this job. I sort of stumbled into it by accident. Most of my career had been spent in academia. I had spent a little time earlier in my life homeless. My father spent 15 years homeless and died outside in 2006. And over the course of time, I sort of got more and more interested in that particular problem, in part because of my personal interest in it. And was drawn into it more and more. I worked for the Vancouver Housing Authority up in Washington for a little bit. I worked for the Council for the Homeless there in Vancouver as well, and did some work in the Portland metro area. But in 2016, I decided that I was driving a little bit too much, living here in Salem and commuting every day up north to Portland. And I started looking for a local opportunity to do my work. And my specialty in homeless services in particular was in this idea that most of you know about called coordinated entry, which really goes back around 15 years now. But for the most part, HUD didn't really start driving it until around 2015, 2016, when the expectations that every community participate in this new coordinated entry system for access into homeless systems became more of a demand and less of an expectation. So my idea was that I was just going to jump around from community to community as a consultant and build these coordinated entry systems and move on. So I saw a job that summer in 2016 for something called the Mid-Willamette Valley Community Action Agency here in Salem. They were advertising for just a 9-month position to come in and develop a CE system, which seems, looking back, to have been incredibly bold to have imagined building something so complex in a fairly short period of time. But I jumped on it, and then not long after I got here, I ended up as the program director of all of our housing and homeless services, our ARCHES project, which is known fairly well across Oregon and parts of the West Coast. It was fairly small at the time. There were only 15 employees in it. We had a budget of about $1.9 million. Today, it's nearly 200 employees and a budget of more than $30 million. And it was pretty small at the time, but you know, it had always sort of had a commitment to the unsheltered homeless population, which was a little bit unusual in Oregon. Most of our community
Hey,
action.
Jimmy, I'm sorry to interrupt you. A few folks on the line are having a difficult time hearing you. Is there any way you can move the mic up a little bit? I just caught that in the chat.
Yes, let me see what I can do. I am very sorry, guys. I had I'm going to switch microphone to see if that makes sense.
All right. Mary Frances, can you hear me better now?
Yes, and the
Okay.
chat is agreeing.
All
Perfect.
right,
Thank
wonderful,
you.
guys. So luckily I've said very little so far, so you haven't missed a whole lot. My computer just died yesterday afternoon, so I'm making do on sort of borrowed equipment this morning, but the mic I was using, I think, was connected to the laptop and not my webcam, so it should be a little bit easier now. So finishing up that background, I came to the Community Action Agency here in Salem in 2016. It is a CAA that has 9 programs. I'll tell you a little bit about them in a moment, and covers primarily Marion and Polk County, but we actually do business in about 11 counties in Oregon, including Multnomah, some of the coastal counties, all the way down to Lane County. In some program areas, we have a little bit broader reach than just our primary counties of Marion and Polk. Not long after I became the program director over at ARCHES at our Housing and Homeless Division, about 18 months later, I became the executive director of the agency, which I've been since the summer of 2018. So I am at about 5 years in this job. And it really, in a lot of ways, was fortuitous for, me, but also in a lot of ways, it allowed us, I think, to sort of reimagine some of the work that we were doing here locally and sort of come to terms with how we were going to deal with this homeless issue in Oregon going forward. So if you think back to the beginnings of the community action movement, you think back to the 1960s, you think to the early 70s, you think of things like the Rumsfeld memo, the original advice that community actions should be very narrowly focused on problems that they could have sort of an objective and measurable impact in terms of promoting especially self-sufficiency for low-income families. And you think about the Roma movement in the 1990s and the sort of very, very laser-focused approach that Roma takes to community action work. And, in some ways, those were methodologies that were very well situated for the 1980s and 1990s. But here on the West Coast in particular, community action has sort of had to reimagine itself, especially in Oregon, because the face of poverty in 2020 looks very different than what it did in 1990. The size of our homeless population on the West Coast, as Mary Frances has said, has grown so dramatically that it's almost unimaginable. It's almost unrecognizable compared to what it was 30 years ago. We literally have hundreds of tents, folks living along our streets, along our rivers, under the bridges and underpasses and things of that nature. And it had just become really, in a lot of ways, a crisis. So it sort of gets back to that issue in Oregon. And there's still, I think, some disagreement and some at times tension, and at times some level of discomfort, I think, that a lot of community action agencies have toward dealing with this particular problem, because it seems in many ways outside of that box, outside of that very narrow focus that community action was born into in the 70s, 80s, and 90s. It seems in some ways too complicated for our work to really be able to have a major impact on, especially given the scale of West Coast homelessness. It's also complicated in the sense that it's not just a housing issue. You have to back way up and from 20,000 feet look at this issue on the West Coast, especially, and imagine what is modern homelessness. Certainly, it is an economic crisis that pushes most people out here into conditions of homelessness. But in terms of solving this long-term chronically homeless population's crisis, it's not just housing that's going to solve it. It requires other supportive services, especially behavioral health. And we don't have a whole lot of assistance here on the West Coast or anywhere in America anymore from that particular industry, because in many ways, the behavioral system, health system in the United States was destroyed in the 70s and 80s. You know, you go back to the Community Mental Health Act of 1963, you look at deinstitutionalization, which, you know, in the context of the time seemed like the wise thing to do. You look at the rise of the drug crisis in the 1990s, even opium since 2000, in the last 25 years. Opium was largely a dead drug in a lot of ways in 1999. And then you look at the explosion of the opioid crisis the last 20 years. You look at the, just the really painful and catastrophic and just crushing number of fentanyl deaths that we're having across the country right now. So a lot of smaller nonprofits look at this issue and think, wow, I don't know that we can really solve this particular problem. This may be beyond our scale, and it certainly in some ways doesn't feel familiar to our DNA, our beginnings, in which we were sort of really supposed to focus on, self-sufficiency issues, really supposed to focus on ending generational poverty in particular, which is a very noble mission. How can we possibly fit in with all of the complex demands around this modern homeless crisis? It's a big problem. Well, my background and interest was in this particular issue, and in a lot of ways in Oregon, the funding structure had sort of moved on from poverty. There's very little in the way of poverty conversation, but there's a great deal in the way of what are we going to do to solve modern homelessness. So in some sense, we redesigned our agency to sort of address the needs of the community. We can move on to the second slide here. We sort of redesigned our agency to meet the needs of modern poverty here in the Mid-Willamette Valley. So this chart is actually something we created a couple of years ago. Tells you a little bit about my agency. It's already out of date because we've split our homeless services again because it's gotten so large, but I'll just briefly go around this wheel to talk a little bit about the work that we do. We run the Weatherization Assistance Program. That should be very familiar to every community action person across the country. We run the Energy Assistance Program through LIHEAP. That's also something that should be very familiar. We have a small reentry project for folks leaving incarceration. Refer to that population out here as adults in custody. And that's not typical community action work, but it's something we've been doing for about 20 years. And it allows connections to local government that are pretty deep and rich in terms of the partnerships that we have around reentry. And we hope to really grow that program in the future. We run a very large Head Start program, Head Start, Early Head Start. There's a state version of those programs here too, like there are in many states across the country. We have 915 Head Start slots this year. So that's a lot of early learning work that we're doing through that program. We also run at the 7 o'clock position here on this wheel, a runaway and homeless youth program. We provide a drop-in center here in the downtown part of Salem, and we also have the region's only shelter for runaway and homeless youth, ages 11 to 17. I pause on that age range for a second, but we have a 10-bed facility here in Salem, and we just opened up another 10-bed facility in a rural part of our county as well. So we have 20 beds for RHY populations and a contract from the Department of Human Services here in Oregon for referrals into that program. We run the USDA program for family-based childcare providers as well. That is a fairly large program, covers 11 Oregon counties. And it's also one that, from an administrative perspective is not like a lot of parts of the country. We run it on a very thin margin. So we are the last community action agency in Oregon to run this particular program as a sponsor. But it does a lot of really good work, and it helps us to connect and build family-based childcare in Oregon. And all 36 of the Oregon counties are essentially a childcare desert. We just don't have enough here to even begin to approach the need levels. We run another program called Childcare Resource and Referral, which is a training and technical assistance program for family-based childcare providers. And the one that I'm going to speak to you here on today mostly is our Arches project. That is our adult homeless services and all of the dimensions and all of the sub-programs within that particular department that addresses all facets of our homeless situation here in Oregon. If we can slide to the next slide, please. Thank you. So one of the things we began to do is we probably have in Oregon the closest partnership with our housing authority of any community action agency. So we align a lot of our services with them in support of their projects, and they align a lot of their work and give us a lot of vouchers in support of our work as well. So a few years ago, we opened the region's only permanent supportive housing facility. To give you an idea of just how far behind Salem was compared to Eugene, 7-8 years ago. In 2016, Eugene had around 833 permanent supportive housing beds. Salem had 22. So we really put a lot of effort into this partnership, and we are opening many new facilities in the future that will allow us to dramatically increase our permanent supportive housing beds to meet the needs of the chronically homeless population we have here in Salem, which is a very large chronically homeless population compared to the national chronic population. Our unsheltered population is around 45% chronic here in Salem, which is about 20% more than what you would expect to see in a similar size city with similar kinds of acuity. So this is a 36-bed facility called Redwood Crossings. It's a first of a series that we are in partnership with the Salem Housing Authority. Next year, early next year, we'll open Sequoia Crossings, which will be another 60-bed facility. We also just opened Yaquina Hall, which is another 60-bed facility, all in partnership with our housing authority. They own the buildings and we provide the services at these particular locations. So this is a way that we can dramatically increase the number of folks who are exiting homelessness and get them lined up with an entity that does have resources for housing and in terms of our public housing authority. We provide case management services there. We have partnerships in terms of health navigation, in particular with local healthcare providers. We run respite facilities out of this particular facility as well, in addition to a lot of other shelter care plus type work that we do, local mental health supports and peer supports as well. If we can go to the next slide. Please, thank you. We also had something here in Oregon during the pandemic that was modeled on a California project that was really designed to go out and acquire older motels that were, I won't quite use the word distressed, but were 30 years old or so, and were theoretically suffering from a lack of tourism during the course of the pandemic. Those assumptions weren't quite accurate in a lot of cases, and across the state, we ended up paying premiums for these motels. But given the situation here in Salem, and given our particular work as a community action agency and our prioritization of addressing this homeless issue in particular, especially the chronic homeless issue, we ended up purchasing 2 of these. So the facility you see there at the top is the old Super 8 motel here. It's 75 rooms. We bought that with state funds. We don't owe a dime on it. We paired it up with some FEMA reimbursement money and some other money from the state, and Oregon also has a Medicaid waiver where we will be allowed to charge Medicaid for case management services. So there's a lot of different resources going in. I could talk for 2 hours about that particular project. The Department of Human Services recently gave us a couple of $1 million to help operate a Shelter Care Plus program out of these 2 facilities. So that is the older one of the 2 from 2021 at the top. We call that Arches Inn. And we just, on March the 15th, closed on this second property, another 75-room motel, also along the I-5 corridor, and we're calling that the Arches Lodge. We have some veterans in there. We have Shelter Care Plus folks in there. We have Title 42 refugees that are coming into that location. So this gave us, we went from 0 shelter beds 5 years ago I'm sitting here today with 300 shelter beds between these types of properties that I'm talking about here. Priorities going into these facilities are medically fragile. We have the average age of death for our homeless population in this community is 52 years of age. They are dying of all the same things that you and I are dying from. They're just dying 20 years faster. We don't have a lot of great coordination between hospitals and homeless providers in Oregon, and the handoffs there have sometimes been pretty poor. But we have resources now to make sure there are better handoffs, and people who need some level of medical care, but not a hospital level of medical care, are able to get a motel room, access to a bed, case management services, food, those sorts of things, so that we can get their medical conditions stabilized. And hopefully while they're there, we can work on other barriers and get them connected into housing. These things are expensive to operate. They cost us about $1.2 to $1.3 million a year, 24/7, 365 days a year staffed. We bring in a lot of medical providers, mental health services, county behavioral health, and things of that nature to work with these clients. These are all chronically homeless folks. In many cases, they've been outside for 9 or 10 years. They've been living in tents and under tarps and those sorts of things, and sometimes acclimation into these kinds of extraordinarily low barrier shelter projects is difficult. In Oregon, there are 3 reasons why people choose not to seek a shelter bed. It's either because they have a pet they don't want to give up, or we allow the pets. They have a partner they don't want to separate from, we allow the partners to come along, or they have a sobriety issue. And a lot of historical shelters in Oregon have been, have expectations around sobriety. These are wet shelters. You don't have to be sober to use them. We don't allow alcohol or drug use on property, but as long as you can maintain your behavior, you're in good shape to go. So these places are filled, and we have really considerably reduced the street homeless population of Salem as a result of that. If we can go to the next slide, please. And the governor was here just last month to open our navigation center. So this is a combination of a service we already run in downtown Salem. We have a very large day center where we see about 200 homeless clients a day. We have about 1,000 mailboxes, and that tells you just how many people are using it on a regular basis that folks come in and out of. But this is a model that's somewhere a mix between the shelter and the day center. And again, they were also based on a California design to help get people in off the street, get them services, extraordinarily low barrier, like the turnkey motels, like the Arches Inn and the Arches Lodge. They are also, pets and partner friendly. They are also not something that requires sobriety, so they're wet shelters. And as a result of that, we have very high demand to get into these particular projects as well. So the idea is that these things should not be a standard shelter. They're really more like a train station. They're really meant to get somebody in, get them stabilized, get them sleeping regular hours, eating regular meals. And that does a lot for folks' mental health and get, stabilizing behaviors, and get them working with on-site mental health that we've employed there. Get them their documents so that we can get them on into permanent housing. So the ideal length of stay here is about 90 days. We are in a very rent burdened community with only about a 2.5% vacancy rate, which is quite low by national standards. So it's sometimes difficult to find the units that we need, but we have enough resources. We can essentially entice landlords into taking our clients. So this is a very successful model. So between, the turnkey motels, the Arches Inn, the Arches Lodge, these navigation centers, it essentially gives us a fighting chance for the first time. So if we can go on to the next slide. I'd love to save what the balance of time I have to take any questions from anybody around the country. I realize this work is non-typical for a lot of community action agencies, but in a lot of ways on the West Coast in particular, this is the wave of the future in terms of what the priorities, the funding priorities in particular are of state and local government. It has reached a crisis proportion. It is the #1 issue on the West Coast. So it's an opportunity, I think, for community actions to, in a lot of ways, reinvent and reimagine themselves and to, really take a step onto the front lines of fighting modern homelessness. And I think it is for our agency, we have grown from, 5 years ago, 7 years ago, we were around 220 employees. We were around $26 million. Today, we're at 515 employees, and we're at around $70 million in services and goods that we can bring to, supports that we can bring to our local community. It has really changed the profile of our agency in the community and it made us the most indispensable partner of government. So I really think that despite the fact it's uncomfortable, despite the fact it is very difficult, and despite the fact that it's really not, in some ways, what our networks across the country have been doing for the last 50 years, I do think it's going to be really critical that community actions nationwide get involved in these efforts to end homelessness, because I think that's going to be, the face of poverty here in the 2020s, 30s, and 40s as this continues to get worse. Okay, who has a question?
We've got some questions rolling.
Okay.
First, thank you, Howard, for your message. I'm going to pass that message along directly to Jimmy. Just for context, Jimmy, Howard is also with the CAA in Oregon and is interested in understanding more about Medicaid, that Medicaid waiver for supportive services. So I will relay that information to you directly via email.
Thank you.
Next question. Oh, go ahead.
So the Medicaid waiver is very new. It's the 1115 waiver. I know your executive director very well. And, we've had a little bit of this conversation. The Oregon Health Authority, which is responsible for working with the coordinated care organizations in Oregon to roll out that waiver, is still in the process of rulemaking. We've got a little bit of a head start on this because of the nature of the work we do. So it's really a conversation with your local CCO, Howard. That's the best path to get started. But I see your email and I'll follow up.
Awesome. Next question. How did you gather community support for providing additional services to people experiencing homelessness? From Gail Drexer.
Gail, it is a challenge at times, and I would say that 10 years ago it would have been a much more difficult challenge. This community was very much a sort of a law enforcement, pull yourself up by your own bootstraps, worthy poor sort of lens on who deserved assistance and who did not. So a lot of it is education. If you look at our original charge, you go back even to the Rumsfeld memo, one of the major things community actions are supposed to be doing, probably is more important in some ways than the services that they provide, is to advocate for people in poverty, to create better understanding in the community about poverty, and for especially, sympathy perhaps isn't the right word, but support for the struggles of people in poverty. So we put a lot of effort into that. Our media presence here in Oregon is quite considerable. I try to make it the case to be on the, in the newspaper every week, and we're frequently on Portland television, and we build local support here, especially with our elected officials, so that we can, explain why this work needs to be done. We go to neighborhood association meetings and every community gathering that we can to sort of get our message out about our services, but also about, the critical needs of people in poverty. And over time, if you fight back against those narratives which say that, the homeless population is really, well, they really only have themselves to blame for the condition that they're in, that they don't deserve help, that, they're drug addicts and things of that nature. If you consistently push back against that over time and sort of reframe what modern homelessness is as really an accident, people who are mostly unlucky in some of the events that have happened to them, you can begin to change the culture in the community about, people's perceptions of what homelessness is.
Thank you for that. And in that vein, we have a COC related question from Jana. Can you talk about your relationship with your local COC, and do you receive funding from the COC?
Yes. So we have a very strong relationship with our continuum of care. We are the primary coordinating organization in our community for the continuum of care. 5 years ago, we were part of the statewide, the Balance of State system, the Balance of State COC. It's called the Rural Oregon Community of Care. Howard is part of that COC. And it's got a lot of good people working very hard in it. The problem is the COC system was really designed for East Coast geographies. If you're in a Balance of State system in Connecticut, it's not a very far drive from one part of the state to the other. If you're in a Balance of State system in Maryland, that's workable in terms of partnerships and community coordination. My two primary counties alone, Marion and Polk, are larger than the state of Delaware. So the West Coast geographies are just massive. So that balance of state system never really worked out here. But a few years ago, we recreated, I would say, a continuum of care for just Marion and Polk counties. And that's got the support of all the elected officials. It's got the support of all the other nonprofits that are working in our space here. It's like every COC, there's a lot of tension at times between various partners over how resources are allocated, and especially not necessarily between partners, but who gets served. That question, who gets served first, is always at the front of everybody's mind. So there's sometimes concerns around, why are we focusing on chronically homeless individuals over other subpopulations? But I really think in order to make this work well, you have to have the support of your local continuum of care. So that is another target for that sort of public relations campaign at times, to make sure that everybody is in general alignment as to, what you're trying to accomplish.
Thank you. Next question. What percentage of your CSBG funds are supporting your homelessness initiatives?
So I would say 100%. Various agencies around the country allocate those funds in very different ways. Some use it for administrative capacity and other things. Some of it are using it for direct services. Here in Salem, because the agency was so wildly underfunded 10 years ago, our CSBG funds were 100% allocated to our adult and our youth homeless services. And, since our resources have grown, it's no longer terribly critical where we allocate that, because our youth homeless services now is our multi-million-dollar project. Our adult homeless services have a fantastic amount of resources, but we've still left CSBG in those two programs because I think that is the best place in terms for that investment to be made in our work.
Thank you for that, Jimmy. Our next question: can formerly unhoused clients age out, for example, overstay the 90-day expectation of the train station timeframe? If so, what happens to them?
So none of our time limits are hard barriers or hard deadlines. And the reason for that is complex. Obviously, we have, struggles in finding enough adequate sheltering, especially in finding enough adequate housing to move people into. So if people are continuing to work toward and make progress on the goals that they need to meet in order to get housed, 90 days is not really a barrier or limit to us. It could be 120, it could be 180. We don't really care so much about that. What we don't want these projects to become are simply more warehousing of homeless individuals. We want to use them in a very active way so that they're part of the solution. Sheltering is a dead end game in a lot of ways. It's incredibly expensive, and I was 100% against 6 or 7 years ago continuing to pour massive amount of resources into this, because at the end of the day, the resource is gone. You bought a bed for the night, but no one is housed out of it. But as long as you're sheltering resources, Shelter Care Plus, turnkey motels, navigation centers, all of these things are actually feeding into scattered site apartments, feeding into property-based voucher projects owned by the Housing Authority, feeding into permanent supportive housing complexes. As long as there's movement in the system, we're not so much worried about deadlines. We're not so much worried about how long somebody stays there.
Next question: any advice on how to move your local community action agency to a more progressive place, such as your agency? Our state CAAs tend to be stuck in the 1990s poverty reduction initiatives that have not been proven to work.
Well, that is a very challenging question. And I feel like, let me just back up and say this. I feel like my job is less administering this very large agency. I have a team of people who basically run the day-to-day operations in terms of finance and HR, IT. I mean, certainly I'm responsible for those things, but I've got a good core of folks who are really running those activities on a day-to-day basis. I'm not making all the decisions there most of the time. Most of my job is publicly facing. I'm out talking with local elected officials. I'm out talking with the Chamber of Commerce. I'm out talking with our continuum of care partners. I'm out meeting with legislators to talk about how critical more additional resources will be to our state to help, address some of the really tough times ahead. And there are some tough times ahead. I mean, if we look at what's happened nationwide in the last year, Here in Oregon, we just lost the emergency food stamp benefit. I know many of you have already seen that gone before, but in Oregon, that's going to lead to a 1/3 reduction in food stamps for low-income families in our state. The expanded Medicaid definition is now gone. 300,000 people out of the 1.4 million on OHP here in Oregon are going to be moved off of Medicaid. Our rental prices out here, the average 2-bedroom apartment in Salem is $1,430 a month. The inflationary forces, I mean, all of these things are really going to be challenging looking to the future. So when you have these conversations, it's important not to talk about yesterday's it's important not to talk about yesterday's poverty problems. It's really important to talk about what's going to be the reality on the ground 6 months from now. What's our community going to look like a year from now? How are we meeting the challenges of growing housing instability? Well, what's happened to our PIT count and our homeless numbers in the last 3 years? And what is that going to mean for our systems over the next 5 years? So, you know, agencies are particularly obsessed, I think, sometimes with either looking into the past or sort of getting so far down in the weeds in the present, they really can't talk about what the problems are going to be even 6 months down the road. So keeping those conversations focused on the future, I think, is absolutely critical in terms of changing some of those more conservative attitudes around, poverty-based approaches from a generation ago.
For our next question, rural area served here. What would be your advice to not in my backyard kind of interactions? I see both sides of the aisles, but what could be a unifying approach?
So my area of responsibility includes not only a city of nearly 185,000 people, which is what Salem is, but a bunch of smaller cities of around 20,000 folks and a very large amount of rural space in between them all. And so what's been successful for me is that, we wouldn't be successful at all if we just focused all of our services on the city of Salem. What's been successful for me is going to the mayor of Woodburn, a small town just to the north, 20,000 people, the county commissioners in the neighboring county, which only has about 85,000 people in it, and sitting down and talking to them about what the needs are that they're seeing. And increasingly, even those areas have a street homeless population that has gone from 10 people 5 years ago to maybe 30 people today. And, they're getting blown up with phone calls and complaints. The police department doesn't know what to do. So we engage all levels of local government. We talk to mayors, we talk to city council folks, we talk to police departments, we talk to the fire and the EMTs, and have those conversations to sort of build collaborative support to help them with their needs. So if you go into those meetings, if you go into those conversations, not necessarily demanding what you want to do and what you think needs to be done, but asking how you can help them, boy, they're really eager. They're really eager when you come in with sort of an approach that we're here to help you. We're here to help you solve your problems. Tell us what they are. Tell us how we can be useful. And frequently I found that that's a really successful approach. Now, there is always going to be 20% of the population who would rather people like me be driven out of Oregon, who would rather the homeless population be arrested and incarcerated, or driven into California, or here in central part of Oregon, just ship them all to Portland. There's always going to be 20% of the population that that has that attitude and says those kinds of things. It's just really important to remember that they're not your audience, they're not your target, and you don't have to convince them. What you do have to convince is the majority of the rural population that you're there to help, and that this is a serious problem that really needs to be addressed.
Thank you, Jimmy. And in that vein, a next question, similar in nature, but a little bit more focused on lived experience. So how do you get elected officials to actually listen and respect the community endeavoring to end homelessness, but specifically folks with lived experience?
So that one is hard too, because, all of us have this expectation that and understanding that if we incorporate folks with lived experience into our agencies, into our decision making, into our continuums of care, into all of our program design, that we end up with much better and much more effective programs, because people with lived experience show us what all of the faulty assumptions are, show us where the design flaws are and where things fall through the cracks. At the same time, a lot of times when you're talking to the mayor, you're talking to a county commissioner, you're talking to the head of the Chamber of Commerce, or the Rotary, that is sometimes difficult to convince them that people in poverty, people in abject poverty, people who are homeless actually have anything to contribute to this conversation. And it's not alien, I think, to a lot of our experience in community action going back to the 80s and 90s, when we really had to convince, folks back then that, this active participation, our tripartite board structure that requires 1/3 of our membership to be either people in poverty or representing people in poverty. It was a struggle back then to convince, those same sort of business and community leaders and elected officials that they had anything worthwhile of saying or contributing. So I do two things here. And one, this is pretty subtle. And I think a lot of communities miss out on this. Our youth work, especially in rural areas, changes the conversation. So when you go in, and instead of talking about 35-year-old people who are having drug problems and folks who are camping in tents next to the river and polluting the local, scene there, you go in and talk about 16-year-old runaways who don't have a safe place to sleep at night. You go in and talk about the very large sex trafficking industry that is, sort of plaguing the country right now, especially along these major interstate corridors. You talked about victimization. You talk about just the realization that 80% of our homeless population is from within 20 miles of our, of our homes, our locales. The nature of that changes. They're much more eager to begin to help that population. And then once they understand that the adults are just the same group of people 20 years down the road, it really changes the tone and tenor of those rural communities being willing to engage with this issue. So, we really sort of center that work around populations sometimes that some of those communities do have more sympathy with. And then once we can get our foot in the door with that conversation, the other stuff comes fairly easily.
Okay, next up, and I think this question actually speaks to Project Turnkey 1.0 and 2.0. What, if any, new programming initiatives did you institute with the onslaught of COVID funding resources? And if you did, are you continuing to invest?
So COVID funding in Oregon impacted us in two ways. One, I know many community action agencies around the country ran the Treasury Department's eviction prevention program, rental assistance program. Our agency ran that program here locally for Marion and Polk counties through Oregon Housing and Community Services, which was the recipient of the state funds for that. Between the federal program and the state program, we've spent something like $37 million on 5,500 households since July of 2020. Most of the federal stuff obviously now is gone, but the state has really moved in a lot of additional resources there. So we have continued to do a lot of prevention work that really we didn't do before COVID, and sort of that funding is leading that programming decision. But part of it too is reimagining, who we were in some ways, because and I think one of the struggles that we had in Oregon for community action agencies is all of a sudden they had 20 times as much resources they ever had before for eviction prevention, but they tried to run those resources through the very same programs that they always had, the scope and scale and all of those things, and they just didn't work very well. So I have a very good program director, chief program officer now. And she basically looked at this and said, this isn't going to work. I'm going to go build a call center. So we hired 30 people just to sit in a call center and distribute those resources. We spent down faster than anybody in the state and actually helped other counties spend their money after we were done because of that. So we learned a lot from COVID in terms of reimagining how we did our work. But in Oregon, there's still a lot of state resources coming along behind the federal resources. The scale will be less, obviously. But other than that, we didn't really get a whole lot of additional funds other than the ESG CV2 grant from the feds in terms of homeless housing. In fact, most of the resource in Oregon actually went not to the homeless population, but to folks who were already housed, prevention populations. So I guess the one major thing that we were able to capitalize on during COVID was that the state really pushed a lot of money into these turnkey projects. The original round was around $75 million. Round two was around $50 million. We just saw that as an immediate answer for our community to shelter, 75 rooms in each one of those motels, but really we can get probably 100 people in each one of those motels. So that's 20% of the average daily unsheltered population here in Oregon, or excuse me, in Salem. So that made a huge difference locally. And we've had to look for other ways to pay for this once all that's done, right? So we got some FEMA money as a Kickstarter for some of the sheltering work we did during the emergency. We paired that up with some of the wildfire relief work that we've done. This Medicaid waiver, 1115 waiver, a lot of the Medicaid reimbursement stuff we've got going on, but really more than anything else, it's the Oregon Department of Human Services, which has sent about $3 million our way to run these shelters through a Shelter Care Plus model. So that allows us to take a lot of medically fragile folks and other folks too who are endangered and to keep those programs funding. So it's just a constant fight to keep the resources that we need to get this done. But I think the most important thing is you have to convince government to spend the money on your priorities. And our priorities are keeping people from dying outside, getting them off the street, getting them into shelter, and getting them into permanent housing. And since we're fairly successful at that, resources have followed it. And the one thing I've learned about government out here is that if you can demonstrate proof of concept in an environment when a lot of people are struggling to spend their money and struggling really to get results, the money will follow successful projects. So I'm not too much worried about, the future on that.
All right. We've got about 10 minutes left, and I'm going to try and get us through these 3 questions before I hand it back over to the NCAP team. Does your case management team actively work with clients to find housing and employment, or do they leave it to the clients to do on their own and report back?
Jennifer, those case managers have about 20 clients each, and they are actively working almost every day with each and every one of those clients to help them fill out applications for housing, for project-based facilities that are owned by the Housing Authority, to help them get some of their barriers addressed, to get their documents collected. They are actively working with each and every one of those clients every day. Our homeless population is so high needs. If I just handed them a voucher and said, go forth and be fruitful, find your own housing, that would fail nearly 80 to 90% of the time. So it just won't work if we leave it to them alone to do that work and to get leased up. They really, in many cases, need an advocate when they go and talk to a landlord that explains what we can bring to the table. And what we can bring to the table is that, we'll come in with a double deposit. We'll guarantee that, we'll pay 12 to 24 months of rent. We have a landlord guarantee program on the backside to make sure that any damage done to the unit when they leave is also, paid for by the state. So without those case managers, all of this breaks down and none of it works. So they're really critical, really critical.
All right, next question. Is most of your funding federal or state? If federal, what programs other than HUD?
So on the homeless front, most of it is state. We do have continuum of care programs. We have HUD COC grants. Not a whole lot though. I mean, probably around $500,000 there. We have Health and Human Services grants. We have, especially for youth projects, street outreach, basic center grants. Those are 2 highly competitive federal grants that we have there. We have we do a lot of veterans work. Some of the things I didn't mention here, we have a veteran specific shelter just down the road. We have 36 beds there for homeless veterans. It's the only facility in Oregon that has a preference for female homeless veterans, which we see a real gap in terms of available resources for that need. And of course, we have direct grants from the VA. We have the grant per diem program that helps fund that shelter. But mostly speaking, the majority of our grants are at the state level, and we've actually gotten in recent years a lot of private grants. So Kaiser Permanente, which is a major healthcare provider on the West Coast, has provided us with nearly $2 million to run housing programs for their patients that don't have housing, that are coming through their medical centers, and they help support our work at REDWOOD. They help support our work in terms of street outreach, and they help support our medical respite work. So it's a pretty varied mix in terms of our grant sources.
So with 1 minute left before I turn it over, we've got a question around, is there investment low or no costs into sustainable, environmentally responsible solutions to housing the unhoused.
So in Oregon, there is a lot of this going on because the homeless population is so large, it is just financially impossible to get to a number where even if state government had the will to do it, they just don't have the resources to house each and every person in their own unit. It would be billions of dollars. So as a result of that, and this is a 30-minute conversation in and of itself, and I'm going to answer it in 30 seconds. As a result of that, there's just been so many more resources that have come into that particular universe. Tiny homes, micro communities, those sorts of things are expanding. Safe parking are expanding dramatically across Oregon, where 5 years ago, most of them would have been non-starters. Local governments would have shut them down. But now, really for the first time, since we don't have the capacity to house everybody, and we don't have the capacity for these high-cost shelters to shelter everybody, those sorts of answers are becoming much more common.
All right, I'm going to kind of turn us back over to NCAP, but before I do, I want to read a comment to you, Jimmy, from Kelly that says, thank you so much for sharing your work and for the incredible work you're doing to fight homelessness and to support houseless persons and families. With that, if you have an opportunity, Jimmy, to type some answers out to Karina and Rhoda, would love that. Otherwise, we'll find other ways to get your questions answered. Karis, back to you.
All right. Thank you so much, Jimmy and Mary Frances, and thank you all for the great questions and engagement in the chat. This is a great presentation today, a lot of informative things shared, so we appreciate you all being here. As a reminder, we will be sharing the follow-up email with the recording, slides, and resources, so stay tuned for that. We also want to hear from you, so your feedback is important to us as we are planning and preparing webinars and training events. So if you could take some time and complete the evaluation survey to let us know your thoughts on today's webinar, that would be greatly appreciated. We also wanted to share, we have a new housing and homelessness prevention resource hub that's available on our website. It includes resources, toolkits, webinars, and highlighted innovative initiatives from other community action agencies across the network, like Mid-Willamette Valley, who are actively engaged in this work. So if you have not already checked that out, we encourage you to do so. We also have another webinar coming up with the National Alliance to End Homelessness. This webinar will be on effective coordination, working across service systems to impact homelessness. Will be on June 28th. So we encourage you to register and join us again in June. And that is one of many webinars that we have on the horizon. So we encourage you to check out our webinar Wednesday schedule and see what other topics are available. I know we have reimagining impact with a whole family approach coming up soon, as well as artificial intelligence and community action. So we encourage you to check those out and register to attend. The Community Action Academy is our free online learning hub for the Community Action Network. We encourage you to sign up and access free e-courses on topics such as advancing family-centered coaching and health intersections. These e-courses have videos, resources, activities, quizzes, and the opportunity to engage with peers across the network. Fresh Finds is available on our website. This is where you can access the latest anti-poverty resources, webinars, and funding opportunities from other organizations engaging in anti-poverty work across the nation. We keep that list updated periodically to ensure freshness, so we encourage you to check it out and see what resources are available. Registration is now available for annual convention. We'll be in Atlanta, Georgia, August 23rd through 25th, so we hope you will make plans to join us then. And if you have any questions following today's presentation, this is the contact information for our practice transformation team. So feel free to reach out to any of the individuals listed here. And once again, we just want to thank you all for taking the time out of your busy schedules to join us for today's webinar. And thank you again to our speakers for lending their expertise and leading us in this important conversation. We hope you all have a great rest of your day. Thank you.